Hello. Can gynecomastia come back even after surgery? This is one of the most common questions we get from our gynecomastia patients. And to answer this today, I am Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore. Now, to understand whether gynecomastia can come back or not after surgery, we need to first understand how gynecomastia happens in the first place. What is gynecomastia? Gynecomastia basically means overgrowth of glands in men. Men also have breast tissue, like women. But normally in men, this breast tissue does not grow. In some men, when there is a hormone imbalance in the body, this tissue can get stimulated and it grows. This imbalance can be a lack of male hormones or too much female hormones. If this balance goes, then the glands get stimulated. The most common reason for this is during puberty. During puberty time, there can be some imbalance in the hormones and this gets stimulated and this happens. Problem is, even after the puberty, when the hormones become normal, this does not go away. The other common cause for gynecomastia to happen is after any external hormones. The most common reason for this is steroid use. When people go to the gym and they take steroids, these steroids, while they bulk up your muscles, they get converted into female hormones in your body, and this stimulates this gynecomastia growth. The third reason for gynecomastia is any hormone disorder. If there's any tumor or cancer producing these hormones, then this gynecomastia can happen. So this is how gynecomastia occurs. So how is gynecomastia treated? Well, the thing is, there is no non-surgical treatment for gynecomastia. Even if you control the underlying hormone problem, for example, let's say puberty. After puberty, the hormones become normal, but this glandular tissue does not go away. And because it is glandular tissue, it is not fat, you cannot burn it away in the gym or by dieting. In fact, when you work out in the gym, the muscle might become bigger and the gland might start showing out even more. This is what commonly happens. So the only way to treat this is by surgery. Now, we do the surgery a little bit differently from most other places in that we do it under local anesthesia. We only give anesthesia here and we do not make you unconscious. We do it this way because one, it makes the surgery very, very safe. There are no risks of general anesthesia. There is also less chance of causing any kind of internal damage while you're doing the procedure because the muscle layer is not anesthetized, it is awake. Even if you touch the muscle layer by mistake, it contracts and it doesn't let us go in. Secondly, during the surgery, I can make you stand up and see how it is looking. Then I can make you lie down, do some more, so the result can be better because things look one way when you're standing up and another way when you're lying down. So this is why we do it under local anesthetic. The short answer is we cannot treat this procedure without surgery. To know more about the surgery, you can see our other videos related to this. Now, finally, coming to the main question. After surgery, can this still come back? Well, it is extremely unlikely, but there are a couple of ways in which it can come back. First is if the gynecomastia, the glandular tissue itself, actually comes back. This can again happen if there is again any hormonal imbalance in your body. This kind of hormonal imbalance again be mainly for two reasons. One is if you're taking external hormones. If you start taking steroids after the procedure or any kind of hormonal tablets after the procedure, this can again get stimulated and this can again come back. Secondly, if there is some rare kind of cancer in your body which is producing hormones, again this can get stimulated and this can come back. But these are very rare scenarios. Those kind of hormone producing cancers or conditions in your body are very, very rare. Secondly, we always counsel our patients and make them understand the importance of not taking steroids. So as long as you look after this, there is almost a zero chance of this ever coming back. So that was for true gynecomastia coming back. The other thing which can happen is something called pseudogynecomastia. Pseudogynecomastia means it looks like breasts, it looks big, but it is not glandular tissue. It is fatty tissue. This happens in overweight people. When you have put on a lot of weight and there's a lot of fat, that fat in this area creates the appearance of gynecomastia. It looks like male breasts, but the difference is there is no glandular tissue in this. This kind of pseudogynecomastia can come back if you put on a lot of weight. So if you put on 15-20 kilos, you become obese, then this can again happen and pseudogynecomastia can happen again. So you should need to avoid putting on this fat in your chest area through your diet and workout. So I hope this video answered your questions. Gynecomastia is a problem suffered by many men. It's one of the most common procedures we do here in the Venkat Center. And it's a simple treatment to get rid of it and give you back your confidence so that you can live your life to the best of your ability. And as long as you take care of these things, you don't take any external hormones, and there are no hormonal conditions in your body, the result is permanent and it does not come back. Please like, share and subscribe. Do let us know what other videos you would like to see. Thank you. Have a great day.